Yes. Can I introduce you
Sure.
first, Dr. Usef? This is Dr. Rosemary Usef, who's with the University of Louisville, and she's going to discuss the patient's drug therapy and also talk about her patient. Dr. Usef is the Director of Clinical Transplantation and Professor of Medicine at the University of Louisville.
Well, thanks. I wanted to also thank the donor family because that's what makes all of this possible. I'm going to be doing the immunosuppression along with Dr. Marvin, and we did use thymoglobulin in the operating room, and we'll continue that. And then we will start Prograf, Myfortic, and steroids, which are standard immunosuppression. And again, as Dr. Kutz said, this is part of a team also. Probably one of the most important people is Brenda Blair, who is our nurse coordinator, who does help us with following all the immunosuppression. And she'll be helping us while he's still here. Then there's Dr. Marvin, the transplant team, Dr. Eng, Dr. Jones, Dr. Hughes, and Dr. Vascularized, and then Dr. Kaufman. Thank you.
Thank you, Dr. Usef. And now, is Jenny Jones here? I thought you were over there. Okay. Jenny, if you want to come forward, I'd like to recognize Jenny Jones. She's the Director of Education at Kentucky Organ Donor Affiliates. And Jenny's going to talk to us about organ donation.
Thank you, Barbara. This is just such a great opportunity. As Dr. Usef said, it is because of donors that we are able to do operations like we did today, surgeries that enabled a person to have the use of both hands. And as Dr. Usef also recognized the donor family, this was a family that came forward and wanted their son to be known for his legacy of the gift of life. And the reason they knew that this is what he wanted to do, he was 22 years old, and a lot of times we don't have conversations with our loved ones about what we want to do after our death because we don't like to think about that. But this young man got on the Texas Donor Registry, and so when he passed away, his family knew that this is what he wanted to do. They knew it was his decision. And so it's just a perfect opportunity to encourage everyone to join the Kentucky Donor Registry next time they renew their license, or to go online at donatelifeky.org. And I just really appreciate this opportunity to, again, thank the donor family. That is what makes this all go around. If we didn't have our donors, we would not have any kind of transplantation. So it's just so important, but so is this donor registry. And again, I appreciate it with Jewish Hospital having this opportunity to thank the donor family and to encourage any listeners and readers to donate life through the donor registry. Thank you very much.
Now, if there are any questions for Dr. Kutz, Dr. Usef, or Ms. Jones.
Dr. Kutz, you talked about the flexors. Do the complications that happen with those mean that he may not have the full use of his new hand once he recovers, or is that a further concern for all the use, first of all?
Well, it is a concern as far as the use is concerned. As those of you who may have seen Donnie, who was our last transplant, who within 48 hours had a very nice functioning hand. In this case, he has muscles, but he doesn't have all of them. And we had to do, as we do in many cases, utilize muscles that that the good Lord put in there for one job, but he also gave us the knowledge to move it over to do a second job. So we feel you'll still have the important things of actually lifting the wrist up and making the grasp, which is important as far as function is concerned and doing things. And with his age, he may not have as good a function as he would if, if he'd had those other muscles that had not died in the original accident.
Is he the oldest of the 8 now, or close to it?
Maybe he's close to it. Yeah.
What about, would his age have been a factor? Obviously it wasn't, you did the transplant, but would that be a factor in some cases?
I think it could be a factor. I'm not... Though I'd like to think that if I lost my hand and somebody give me one, they'd give me one back. I don't think that aspect. But I think more health has more to do with than age. If you had somebody that was diabetic or severe illness and other types of things like that, then I think you'd be hesitant to transfer it, something to it. You'd look for another donor or recipient, I would say, really. This is not an easy thing for the patient to go through, and you'd hate to think that in the middle of the operation, the guy has a heart attack on you or something. I see Dr. Marino stepped in. Is there anybody else out there that came in? Dr. Marino? No? Okay. I guess I'm not seeing him.
Any other questions?
At the bottom of the release here, Barbara, it says the hand transplant is sponsored by the Department of Defense and 2 other defense agencies. Is this entire thing paid for by the government in terms to further that research, which I would assume would be combat and those type things? Or can you explain that relationship? Who's paying for what?
And I can ask Dr. Kutz to address that.
Yes, this project has been supported by first of all by the Navy and then by the Army Defense Department, and they've supported all of them that have been done pretty much in the United States. It is a large expense, and it is and has been in preparation for particularly to utilize patients who would be injured in service. There has been a few of them. One of the things we have to consider, though, is if a patient has not had a use of a prosthesis, it's somebody we'd like to be sure that somebody has a use of a prosthesis before they do it. At least that's our personal feeling. The reason is because you take some young person that's just lost his arms in the service, he will expect to have normal function within 24 or 48 hours, which is impossible because it's going to be a 9-month to a year and a half situation for recovery. And so there has been one, I believe he was a Marine, that had bilateral transplants put on it in Pittsburgh, and he's a very unhappy young man because he has not got the function he thought he would have that he had before he went overseas.
What type of prosthesis did Mr. Thurman have?
He had a low elbow prosthesis, in which he said he used for a few years, and we wanted to bring it into him so we could test his function with the prosthesis on and then have something test his function with the new hand. But he says, I threw it away, it's in the garage or it's in the barn or someplace, but I don't think I could find it. So his below elbow combination of hook and cosmetic, I think at that stage is probably the most popular ones. But now they have myoelectric, which is the popular one, which theoretically will, with the stimulation of the muscle in your arm, would open or close it. But it's still quite heavy and awkward to use in many situations. So a lot of people just don't, if they've got a good hand on one side, they just don't use the prosthesis. Anything else? Okay.
If there are no further questions, I want to thank you all for coming today. If you didn't already receive some B-roll, please check with one of our communications people, and they'll be happy to provide you with some. Thank you.